The New York State Comptroller says New York is failing its veterans when it comes to health care. A new audit found in nearly 90% of cases analyzed, local social services departments didn't advise veterans they were eligible for benefits from Veterans Affairs. As Brendan Lewis reports, the Comptroller says if the issues are fixed, it could save taxpayers millions.
Where did the breakdown occur?
Well, the breakdown occurred at a couple of levels. Number one, at the localities, they weren't using the systems they had set up for making the referrals. Their databases and the referral forms were not used.
The Comptroller says in Albany County, of 18 veterans records reviewed, none were referred to the VA and were instead given right to Medicaid. Statewide, only 10 of 91 records were properly passed on. The health department disputes the placement of blame, saying in a letter to the Comptroller, quote, "You failed to acknowledge that the state is currently working to phase counties out of the process, automate the system, and coordinate benefits through New York's health benefit marketplace."
Well, New York is actually doing better. Nationwide, it's between 40 and 50% are accessing some VA benefit, and New York, it's right at 50%. So New York is doing better, but we don't want to spike the football at 50%. We know that there's almost 1 million veterans that are uninsured.
The VA says it's working to better inform veterans, while the state is also working to get the word out. The Comptroller's office believes just getting some veterans to get services through the VA could save taxpayers money.
Between $100 and $200 million a year in terms of Medicaid expenditures are made for veterans. And if even a small percentage of those expenditures could be in some way provided through the Veterans Administration, the savings to state and local taxpayers could be fairly significant.
The Comptroller also notes the audit simply found the counties are failing to inform vets of their benefits. At that point, it would be up to the veterans to decide if the VA or Medicaid would provide better options for care. Brandon Lewis, CBS 6 News, Albany.